Hey guys, happy Wednesday. Happy live day. So just as a reminder, nothing that we're saying in this live is medical advice. This is really for education and inspiration and really to like springboard your own research. These are kind of born of like just a place to compile things that I've researched and for you guys to kind of pick my brain on my thoughts and opinions about things, but in no way is this me like treating or prescribing or diagnosing anything. So just, remember that. I'm not a doctor. And I'm going to go through and answer some pre-submitted questions really quickly. They're pretty straightforward. And then I'll start getting to your guys's questions. I'm delving more into mineral balance, and wow, is that stuff controversial, LOL. I'm looking into Morley Robbins and the iron overload, lack of bioavailable copper topic, which argues that we should be getting more copper in our diets. But then if you're dealing with estrogen dominance or taking hormonal birth control, copper IUD, then too much copper could be absorbed. So would you only want to consume more copper-rich foods if you don't have estrogen dominance? And would women with estrogen dominance or who are taking oral contraceptives or copper IUD utilize their iron better, or is that type of copper from birth control or the IUD the kind that's not bioavailable? So pretty much she's trying to work out, if you're familiar with the idea of like copper toxicity and the fact that copper and iron or copper can store up in the tissues with estrogen as well. That's like pretty well-known knowledge. But remember, Morley Robbins is actually talking about bioavailable copper. So he talks a lot about this term copper dysregulation, meaning that you can be both copper toxic in the tissues, meaning you have lots of non-bioavailable copper stuck in your tissues, all the while within your cell, you're actually copper deficient. Remember, there are many different forms of copper. And so when we're talking about bioavailable copper, it's the specific copper, the copper that's found in liver, the copper that's found in bee pollen, the copper that's found in whole foods vitamin C. It's not just any old copper, like any old metal that you would be intaking. So I hope that kind of clears up the question for you. Iron is the real problem, and copper is kind of the solution, as well as the other minerals. Like, don't overlook the importance of magnesium in that equation either. I'm thinking of I'm having some colon rectal irritation and inflammation due to hemorrhoids, and now they're causing some rectal bleeding. Any advice? Thank you so much. Well, my first advice would make sure you get it checked out, by a doctor. If you haven't already done that, I think that's like, obvious, but I've personally struggled with that in the past when I had really bad gut dysbiosis. And the thing that helped me the most and got me the most relief was a lot more fruit and root fiber. So like things like parsnips, beets, like really making sure I was getting enough fiber. Also, vitamin E suppositories helped me a lot. I've used both like ones that are specifically made for that, or I've also just used regular vitamin E capsules as like suppositories. And then like rhubarb extract really helps me as well. So just different things like keeping things kind of flowing so that you can get the inflammation in the intestines down. But yeah, I do think it has there's definitely a metabolic component and possibly like gut microbiome component. Can you have regular periods and still have PCOS? I have the hair situation, weight gain, and I am insulin resistant with cysts on the ovaries. I'm 46 years old, and is there a definitive test I can ask for? As far as I know, I am fertile. I have copper IUD. You can have regular periods and have PCOS, but you can also have other hormonal imbalances as well. So it's kind of one of those things where having PCOS doesn't always answer our question. I'm always about digging deeper into why do we have insulin resistance? Why do we have cysts on our ovaries? And oftentimes it is very much due to estrogen dominance. Most women are struggling with some form of estrogen dominance because they're progesterone deficient and they're not detoxifying estrogen well. So that can be a driving factor in PCOS 100%, but it can also, not be PCOS and just being those underlying issues as well. And just to clarify, PCOS does need to be diagnosed by a doctor, and they're often going by like the Rotterdam criteria, which you can type in like the 3 diagnostic things that you need, which is either anovulatory cycles or irregular periods and or cysts on the ovaries, which are different than ovarian cysts. Remember that PCOS Cysts are actually just means like lots of follicles showing up on an ultrasound, whereas having cysts on the ovaries is actually a different phenomenon. So a lot of people get that confused. It is confusing. Hi, Jess. Here's a question for tonight because I won't be able to attend live. If our fat tissue can manufacture estrogen, does that mean we could always be estrogen dominant if we had a little extra fat? I always had 28-day cycle, but since I gained a few pounds, keep ovulating on day 10 to 12, so my cycle is only 25 days. So this is different for everyone. There are some women who do gain weight and find that their estrogen dominant symptoms are a little bit more pronounced, but I think this is very contextual to the person. I don't think the answer is being like, well, I gained weight, and so therefore, like, this is the root cause of all my problems. I would always be asking, why was there weight gain? Was it just like you increased your calories and like you were trying to heal your metabolism? Or were there other factors involved for gaining the weight? Because that's often where the answers lie. Like a lot of women will come to me and say, I gained weight and then I started struggling with all these issues, and they're blaming the weight when you actually dial it down, you're realizing like, oh, they're struggling with so much more stress. They started, over exercising or doing tons of high intensity interval training. Maybe they went through like a really stressful breakup or stressful event. They maybe have been unintentionally or intentionally under eating. So there are a lot of factors that could be possibly driving that. So, but yes, I mean, the more fat we have on our body, and I mean like beyond a healthy weight. So most women do need to carry a certain amount of fat to really have like balanced, healthy hormones, but there is kind of like this normal set weight that every woman has, whereas beyond that is technically considered overweight and can contribute to issues, like estrogen dominance. So there is a point where extra weight can actually drive a problem. So it's just kind of one of those things where we have to find that set balance for us. But to blame fat tissue for causing estrogen dominance, like it's a possibility, but it's not always the case. I hope that made sense. I asked last week about me not being able to gain weight, and you said it could be hypothyroid, which I already actually suspected. Should I take a blood test to confirm this? Because I really hate blood tests. Can I just keep eating pro-metabolically, and will it then improve on its own? Or can I do or take something extra to support my thyroid? Thank you. That's really up to you. I mean, some people really want to definitively get a diagnosis. Some people very much suspect they're hypothyroid, but then they get a blood test and it actually like shows up as normal. So that is not always helpful. Some women just like look at their symptoms and know like their hands and feet are cold. They have hypothyroid symptoms. Their temperatures, their pulses are poor. Like they're not sleeping well. Their skin is really dry. So, and they just decide to like support the body. But either way, if we get a blood test or not, we still need to do the same steps, which is support our metabolism. So that's kind of one of those things. But some people do benefit from like getting thyroid medication and getting themselves warmed up with that while they're working on their metabolism. But some people don't find that it helps at all. So I think it's just really what your preference is. Hi, Jess. Only do Pilates 3 times a week, but sometimes find just those 30-minute classes hard to the point that my muscles get so fatigued that I'm shaking. However, I feel okay after that class. Is this a sign that I may be overexercising? What are some signs and symptoms that you may have when overexercising? So overexercising, workouts can be hard. They should be hard, but we should be able to recover from them well. And this is not always a visible like, oh, I feel great after a workout, like I'm fine. Because remember, stress hormones can be tricky. They're little tricksters. They make you feel really good, but you're actually running from an angry bear. And so you have to learn how to differentiate between feeling good and running off of stress. And that can take some time. But usually there are symptoms involved when you are actually running off of stress. Little things like anxiety or overwhelm or feeling like you can't handle stressful situations or snapping at people or feeling really triggered or going to the negative very quick, like you think negatively off the first thing, having hair loss, maybe not sleeping well. So I would look at my life as a whole, maybe my day as a whole after my workout and see like, am I doing better or worse? I know when I work out and I'm not feeling well enough, or I'm like have high adrenaline, I don't feel very good. Like I don't feel like I'm very in control of my body. But I've learned over time to really recognize that. So I think it just depends. But, being fatigued during a workout, that doesn't, that's not necessarily bad. Workouts should be kind of hard and challenging. They're good for our mental strength as well as our physical strength. But it's really how we're recovering all day long after that. Can you talk about the use of gums in skincare products and if we should stay away from those? I'm sure the skin absorbs it. I don't know. I don't really stress about those things, yet I don't really see the point in using products that contain them. Like, that usually means they're formulating the product pretty poorly. They're trying to use a lot of fillers and emulsifiers to change the texture of the ingredients. So to me, that's just kind of like already a red flag in my mind. Are they like absorbing enough to cause problems? Probably not. I mean, probably not. But I always like when I see ingredients like that, like fillers and emulsifiers, remember, companies have the capacity to do it a better way, but they oftentimes decide to just do the cheapest, easiest thing. And when they're doing that, I don't really want to waste my hard-earned money on them. So that's kind of like my mindset when I'm looking at stuff like that. But is it harmful? Probably not. Does taking K2 make menstruation lighter? I think it made mine last less than 2 days, but along with small amounts of spotting. Well, for some women, they're actually in need of calcium. And remember that K2 really helps clear calcium and helps it get into the hard tissues like the bones and the teeth. If you're already deficient in calcium, or you really are not getting enough calcium on a day-to-day basis just because you're not getting enough in your diet, this can actually cause calcium to go too low, which can cause problems. Like, we need adequate levels of calcium. Calcium is a very important mineral. So just make sure, I don't know what your situation is or if you're high dosing it or whatever, but, be careful with those fat soluble vitamins because they can really manipulate minerals. And calcium is one of those things that can really take the hit. And that can affect our menstrual cycle, of course. Thoughts on horseradish? I saw the owner of Cosmo Beauty talking about it and making a ranch. Yeah, I love horseradish. Love using it as like an antibacterial and an antifungal. It works really wonders, especially if you have, so a lot of people with gut dysbiosis, eventually like that bacteria starts to migrate into the sinuses, and they often get like postnasal drip or like a sniffly nose, or they can't breathe through their nose. They're constantly stuffed up. And horseradish, if you've ever had like wasabi or horseradish, they're kind of part of the same family. It has that like burn that goes through your sinuses like nothing else. It really clears things. Sometimes your eyes start to water, stuff like that. That's actually a clearing of the sinuses, the biofilms in the sinuses. So it can be very, very helpful, very, nice tool in your toolbox. Do you go find OBGYN visits necessary? I do them as recommended. PAP every 3 years, that kind of thing. I think that's the recommendation. But yeah, I personally find them pretty invasive, so I don't really love doing them. But I can't really say if you should or shouldn't. I think that's like a personal thing. I did listen to a really interesting episode on Kim Anami's podcast, ANAMI, her podcast, which is called, what's it called? I think it's called Orgasmic Enlightenment. She talks about all things just like vaginal health, sexual health. I really like her perspective, but she had a good episode on that really got me thinking. Do you have how do you control OCD thoughts during period? I don't necessarily have OCD thoughts during my period, but I would be looking at, first of all, my progesterone levels during my luteal phase, and also just how I'm taking care of myself during my period. A lot of people are trying to push during their period. And I talk about this a lot, in podcasts and interviews with people. But remember, we should celebrate our femininity in the sense of we have cycles that men do not have. And our society really glorifies the masculine, the hustle culture, the push, go, and really celebrates women that do that as well. And I really think it's important to step back and embrace that we have ebbs and flows. And there are certain points in our cycle where biologically and physiologically, our body is saying slow down. And if we are not heeding the warning, we actually end up causing more problems for ourselves. So whenever anyone has problems, during the period or around the period, the first thing I'm always asking is just, how are you treating yourself during this time? Is it a time of like nourishment and care? Or are you just trying to push through and act like it's just any other time of your month? Hi, Jess. How can I naturally treat GERD and eat pro-metabolic? Thanks. Well, with GERD, it's kind of just trying to figure out what the cause is. Is it a leaky esophagus? Is it H. pylori? Is it low stomach acid, which is often the case? Is it just like intestinal permeability, like serious gut irritation? When it comes to gut issues, oftentimes they have developed because we're metabolically impaired, and then we're dealing with them. And so it's hard to get out of this place of being metabolically impaired, because when we try to eat ourselves out of the situation, our gut's really screaming at us. So for me, like, I always try to look for, first of all, what are the triggers to GERD? Oftentimes it is stress. When you start to like break it down with somebody, clients, you start to realize like they're stuck in a constant adrenaline state. And so just pushing through and kind of getting them out of that adrenaline state can be very, very helpful, just by eating every 3 to 4 hours, eating kind of nourishing, easy to digest foods, and then working on stomach acid, first naturally. So like diluted apple cider vinegar, ginger, sometimes turmeric can help, so ginger tea, grated ginger, ginger powder, ginger capsules can work really well. Digestive bitters can be very helpful. Doing anything that's going to support enzyme production and stomach acid production. And then if that's not enough to really help, then at that point, sometimes going to actually hydrochloric acid, if it's indicated, can be helpful. But also finding triggers. Like, some people are really, their gut's so irritated, they have this like leaky esophagus, or sometimes like leaky intestines, irritated intestines. Sometimes food are triggers. So things like gluten, sometimes like low quality dairy or food additives. Like, be conscious and wary of what's in your food. Like, pay attention to what's bothering you. And if you've already kind of boiled it down and you're like, it's nothing in my diet, it's something else, then at that point, sometimes it requires a little bit more support. Some people really like vitamin U. I think it can be kind of anti-metabolic, but sometimes for a period of time, it can be helpful. And then, like I said, if there's H. pylori involved, then the H. pylori needs to be taken care of. Which often there is. There's either like bacteria really high up in the small intestine. Oftentimes that's paired with fungus. Very rarely is there bacterial overgrowth without being fungal overgrowth in the small intestine. And then, if that gets higher and higher up into the small intestine, or even possibly the stomach, and then stomach acid's low, it can take up residence there. And that's really when the cascade of issues starts to occur. Dutch test question. If someone has a hormonal IUD, is it worth doing the Dutch? Or if not, how long after removing the IUD can you get an accurate hormone test? Thank you so much. I mean, I would just be checking if I'm ovulating. Like, some women, if you haven't already read my post on Instagram on the hormonal IUD, maybe read it just so you can kind of refresh on it. But I talk about how like some women do ovulate on the hormonal IUD and then some women don't. So it's possible for it to be either. A lot of times when the IUD is pretty fresh, the hormones are there's too much of the hormones and it's preventing ovulation. But then if the IUD is older, a lot of times there is an ovulation. So it just depends on the person. But I would be looking and seeing if I'm ovulating. If I'm ovulating, then you can get a more accurate picture of hormones, because like synthetic hormones don't really show up on a blood test or a Dutch test, only bioidentical ones. So if I was ovulating, then I would just take the Dutch test how I would always take it. But it might not be an accurate picture of all the hormones involved, because remember, when there's synthetic hormones involved, those are not going to always show up, but they can still cause symptoms. So I don't think there's like a right or wrong answer. I think it just depends on if someone's ovulating on the IUD or not. Do you think the DIY red lights are as effective as something like Gamba red lights? They're probably not as effective. You're just looking at the nanometers. So, 660 nanometers, which is like what this light is, and like some of the DIY ones, is not going to be completely penetrate through your body. But for me, like, it's a trade-off. Like, I spent, I think, $30 on this. I spent like $15 on my warming red, like, chicken lamp light. So I just like to have red light all the time, and I actually like the convenience of these clamp lights over like a lot of these more fancy devices. And so I'm not really convinced that investing in these super fancy devices is any better than just a DIY version. Maybe I will get around to buying one and let you guys know how I feel about it. But as of now, I'm just really not convinced. And I'm noticing that a lot of these companies are just like ordering them kind of from the same factory, which is like, it just sends up a red flag to me. Like, these devices are pretty expensive, and I'm really hoping that they are as amazing as they're saying that they are. So I do think that Gemba Red is really good. I have like their small little plug-in, the one that I did in my giveaway, and it's great. It works really well. It feels really powerful. Is it very much different than this one? I don't know. I guess I don't know enough about light to know, but I do know that it penetrates a little bit deeper. The higher the nanometer, obviously the deeper it's going to penetrate into the tissues. And like something like an infrared sauna, for example, or like, a higher, more powerful light that's maybe in the 800s is definitely going to go deeper into the tissues, which can of course be more beneficial, but you just have to be willing to pay the price for it. I know you've mentioned about a refrigerator water filter brand. Can you please remind me? Thanks, lady. Yeah, it's called Clearly Filtered. That brand, they have like a pitcher, they have like a refrigerator water filter, but yeah, it's called Clearly Filtered. Do you like Kerrygold cheeses? Yeah, I buy a big block of their double-liner cheese at Costco, and I really like it. I love their cheese. Please explain how we can make sure we are getting enough iodine. I understand it is important for breast issues. Seafood, I like to eat shellfish multiple times a week. Some people like to take kelp, but it can have a lot of iodine in it. And if you don't have the iodine cofactors that you need, like vitamin C and ZINC, can't say it right now, and like even copper, it can actually cause more problems. So I just add a drop to my milk. Like when I get my gallon of milk, I add a couple of drops, or I'll have like 1 drop of Lugol's iodine once a week. But getting it in food, it would just be anything that's in the sea will be rich in iodine. Is it necessary to have omega-3s in the diet without supplementing? Well, you can't avoid omega-3s in the diet. Like there are, going to be omega-3s naturally in fatty fish, and there's some in like butter, there's some in beef, there's some in, egg yolks. Like there are omega-3s in the diet. It's really about just keeping like polyunsaturated fats low. And like when we are getting polyunsaturated fats, getting them from natural sources so that the omega-6 to omega-3 ratio is a lot better than, having these high amounts of concentrated seed oils. Would I ever supplement with omega-3s? Absolutely not. Like, absolutely not. Do I avoid them at all costs? Like some people in this community? No. But I personally don't see like these essential fatty acids as essential as they're being claimed to be. Hi, Jess. Are there any great references for practitioners who keep pushing vitamin D supplementation and fish oil? It's kind of frustrating. I don't really understand our need to, argue with them. Like they're convinced that they are, they're getting it told from them somewhere. And a lot of people aren't willing to take a step back and say, just because everyone's talking about it as automatically beneficial, it doesn't mean it is. And also many people are not willing to actually look at the why behind things. Oftentimes people will say, well, vitamin D is low, just supplement it. And it's like, well, why is it low? Like you don't have good thyroid function or enough magnesium to make it. It's fine, just supplement it. And it's like, no, let's get to the root cause of the problem, because that problem is probably going to cause a ton of other problems down the line for me. So, sometimes I just don't even argue anymore. It's not really worth it unless they're really someone that is kind of your partner, or just like an agree to disagree person. But I find that it can be very, very discouraging and disheartening to just try to like argue and bring support references, because oftentimes like practitioners and doctors, like they often have this mindset of like, I'm the doctor, I'm the practitioner, like you're just a peasant. And you're like, okay, like, so I don't know if that's how you feel, but I personally, like, I don't really want to, like, it takes work to dig deep, right? It takes work. And there's not like one reference that I can just like compile. And maybe I will work on something like that, like a PDF that you guys can download that's just like has tons of references. But, you know, I think that Ray Peat's articles are a really great place to start. He has so many references underneath, sometimes hundreds. Functional Performance Systems is another like really great resource for finding studies. Just go to his blog section and type in like keywords. So I'll type in like fish oil or polyunsaturated fatty acids, and like so many things will come up. But it does take work because you have to dig deep. This stuff is really buried, and we should ask ourselves, why is it buried? Like that's a whole discussion for a different day. But as of now, it's kind of like one of those things where I just kind of like encourage you guys to choose your battles, because it can be disheartening for sure. Finding my teeth more sensitive, going pro-metabolic, especially a tooth that has had a deep cavity repaired in the past. I'm oil pulling, swishing, and getting sugar off the teeth quickly. You know, so for some people with teeth issues, it's really important to kind of reevaluate the whole Weston 8 price conundrum and like tooth decay conundrum, which is the fat soluble vitamins. So vitamin A, vitamin K, vitamin E, vitamin D are very important in the mineralization process of our bones and our teeth. But we need to have the minerals to shuffle in. And if we don't, it can be really problematic. Another thing that we have to remember is teeth are alive. You know, Dr. Stephen Lin is really, I like reading his stuff on teeth because he talks a lot about interesting stuff. Now he's like very anti-sugar, pro-omega-3, like yada, yada, yada. But I kind of ignore that stuff. But I'm just looking at more of like the gut bacteria connection. And one post that he did, which was really interesting, was like teeth are alive, right? They have pulp inside that's alive, and it's directly connected to our gut bacteria and what's going on in our, you know, our microbiome as a whole. And so trying to get to the bottom of that can sometimes be helpful. Like, are there other gut issues involved? Is there bacterial overgrowth, possibly fungal overgrowth? Like, are you being very good about the raw carrot salad? And then, you know, do you need to maybe explore the gut component a little bit more, like working on with coconut oil and raw carrot, bamboo shoots, mushrooms, things like that. Sometimes activated charcoal can be helpful, but then also exploring the nutrient side of it. When it comes to, you know, the fat soluble vitamins, very important, but even further, are we getting enough of the minerals to shuffle everything in? Because it's one thing to have fat soluble vitamins to get minerals in, but are we getting the minerals in, specifically like calcium, magnesium, potassium, sodium, those types of things. But I actually had, avoiding vinegar, too much acid on days when the teeth are sensitive in general, any recs, and if my dentist really pushes a root canal, any thoughts? For anyone that has had a root canal in the past or is considering getting a root canal, I highly, highly, highly recommend checking out Blodgett Dental Care, BLODGETT on Instagram. I think they have a website too. He literally, his whole job is removing infected root canals and infected teeth. And like the infections that these root canals have caused is actually insane. So I just highly recommend like people be aware of those things, and kind of getting to the bottom of like what's going on. Because remember, like dentists oftentimes have a incentive to like do, you know, a very quick, you know, money making thing. And I'm always looking at like the teeth are alive, you know, what's going on, and the mouth is the flower of the gut. So if there's stuff going on in the mouth, there's something going on in the gut that needs to be taken care of, and that should be explored and acted upon rather than just like going for a quick fix. Now, sometimes of course they're necessary, but just making sure things are explored. Please remind me of the nasal spray you recommended for nasal drip. I think it's called X-Clear. That's one that works really well. Nutribiotic, which is the grapeseed extract one, works well as well. And then some people really like the Ion Biome one. My boyfriend kind of struggles with like nasally type issues, and we've been trying like the different ones, and he really likes X-Clear. X-Clear works really well as long as he's doing it consistently. Like I have him do it like in the morning, pretty much every time he brushes his teeth, like just has it next to the toothbrush. So those are kind of my favorites. Sinu Orego, or it's called Sinu Orego, Sinu or something by North American Urban Spice Co. It's like their sinus rinse. That one really burns, but it can be really, really good. I have also like made a homemade sinus rinse where I just like take a neti pot and I add like some iodine, some grapefruit seed extract, some sea salt, and what else? Xylitol, because it's a biofilm breaker, and have like neti potted the sinuses, and that really works very well as well. What can help with fungus in the body? I have a few warts showing up on my finger and feel a yeast infection coming on. This is part 1. Yeah, so yeast is kind of, and fungus is not like a cut and dry situation, because sugar does feed yeast in part, but that's not the whole story. We already have yeast in our digestive tract. It's a part of our microbiome. We have this ecosystem and it all needs to stay in check. But when it gets out of check from either like overuse of antibiotics, which is very common, usually every antibiotic round, there's going to be fungal overgrowth immediately afterwards, just because when you wipe out bacteria, you often leave a lot of room for fungus to grow, and they're not being wiped out, right? So fungus just will grow back very rapidly because it's the one that's not being killed by the antibiotics. So a lot of people who have overused antibiotics, they tend to have really bad fungal overgrowth. And so this is a dysbiosis issue, meaning that fungus has kind of overtaken the digestive tract, and the IMMUNE system can't keep it in check anymore. This is oftentimes due to like an iron overload, copper deficiency issue. Copper really, really helps keep fungus in check, and is very, very antifungal. And so when we're copper deficient, like oftentimes we have really bad yeast overgrowth. Another thing is estrogen. Being estrogen dominant and having very slow metabolic function, like really slow thyroid function, does not help. So getting our thyroid function up and metabolic function up is very, very imperative, and that should be the first priority. But then we also have to work on the dysbiosis. So sometimes taking some like antifungals can be helpful. And this is where testing can come in handy, because if you do have really bad fungal overgrowth and you know it and you can see it on a test, sometimes a practitioner or a doctor can actually give you like a prescription antifungal if it's called for. But if like more natural options, like there are many antifungals on the market, like oregano. I like SF722, which is undessalinic acid, caprylic acid, pau de arco. Even garlic can be antifungal, but fungus is smart. So you can't just take like a bunch of one antifungal and expect it to like work. You kind of have to rotate them and be kind of conscious and paying attention. Usually like 3 weeks of one is fine, but then you need to take a break and then kind of like revisit and probably try a different one. So fungus is not always easy to eradicate, but as long as people are working on their metabolism, usually like taking something like SF722, like some undessalinic acid or pau de arco, can really help keep it at bay while they're working on the other more deeper rooted issues. And then I really like a probiotic, probiotics that contain Bifidobacterium longum and Bifidobacterium infantis, or very much replicate like what is present in human breast milk. They're very helpful at kind of crowding out fungus. So like it can be helpful while taking antifungals to do something like that. Like I really like Bifido Maximus by the Gut Institute. That's a really good probiotic. That's histamine free, which is important because a lot of probiotics just contain a lot of histamine-producing bacteria, which just is so miserable. Do you know anything about Eustachian tube dysfunction? My ears have been plugged for 7 years solid. Been to a few ENT doctors, and they won't do anything. Thanks. I would look into like fluid. Is there fluid there? Possibly like scar tissue, fungal issues. Once they get into the sinuses, fungus is just very invasive. So I would be looking at like possible like bacterial, maybe food allergies. You know, some people are really sensitive to dairy or have histamine issues that are driving those issues. But you know, I just look at it like similarly to like kids that are babies that struggle with like tons and tons of ear infections. Oftentimes there's like a big gut component involved there. What could cause high calcium levels out of range on my blood test? Blood levels of minerals is usually not the whole picture. So we have to ask ourselves, like, why is the body pulling calcium from the tissues or the hard, like the hard tissues of the body? Why is it pulling calcium into the blood? And this is oftentimes like it can be due to stress hormones. Prolactin does that. A lot of women with hormonal imbalances actually have elevated prolactin, and prolactin can really pull a lot of calcium from our bones. So can ACTH, which is another stress hormone. When we're taking like vitamin D, like a lot of people don't realize they can cause a lot of problems taking vitamin D. So those are just some ideas. What causes pale sunspots to appear on the arms? And ideas for prevention, treatment. Pale sunspots. Usually this is called lipofuscin. It's the mixture of iron and polyunsaturated fats, but usually it's polyunsaturated fats in the tissues. If you're a fully nourished student, I actually have a whole lesson on this under skincare. And I talk about this phenomenon of, when we put these oils either in our body or on our body that are very sensitive to heat and light, like sunflower seed oil or canola oil or soybean oil, these things, when they, why don't you just put those oils on a saucepan and heat it up to high heat and do an experiment and smell the smell and look at the color that oil turns. It turns a dark, rancid brown. And that's what's happening in our bodies when we're exposing ourselves to light, which aka the sun, and then heat. Our body's 98.6 degrees. And we're putting all these like non-biological supportive oils in our body. And that's usually like a big driving factor, but it's oxidation. And then liver can be a factor as well. And there's other things, of course, like we need antioxidants and we need to make sure we're fueling our body. Cortisol can make the situation worse. What is the brand of glasses you're wearing? These are Diff eyewear, DIFF. Thoughts on using organic acid testing? My friend had a TBI with lasting post-concussion symptoms, and the naturopath is trying to find stuff like bacteria that may have exacerbated symptoms. I like organic acid testing. I actually love to use it for detecting bacterial, more fungal issues. I think that stool tests and organic acid tests are a really good component. They kind of complement each other because, there's no perfect test on the market to test gut function. It's really weird, but there really isn't a perfect test. And so you kind of have to take this puzzle and try to just put as many pieces together as you possibly can. But the Great Plains, for example, organic acid tests really can tell you a lot about fungal overgrowths and then and other nutrient issues. And then getting a bacterial, oats does tell a lot about bacteria, but then on top of it, actually running a stool test you'll see more of a bacterial overload. So if someone knows how to read it, I think an oats can be very helpful. What probiotic would you recommend for someone with histamine, endotoxin, and UTI issues? This is a really hard question because everyone's so different. There's so many factors in regards to our own microbiome, including how we were born, were we C-section born or vaginally born, were we breastfed or bottle fed, how many rounds of antibiotics did we get in our first 2 years of life. That completely determines our digestive capacity our whole life. And then going forward, have we been on multiple rounds of antibiotics? Because, the body's supposed to kind of have this process where when we're vaginally born, we get passed through the vaginal canal and we get past all this good flora. And then when we're breastfed, breast milk actually contains very specific prebiotics and bacteria that feed on those little special fibers and sugars to help actually nourish our gut and help kind of create this perfect ecosystem that's going to set us up for the rest of our life. And when that's messed with, a lot of us are struggling with all these issues. And so we want to kind of like nourish and reseed and kind of like treat ourselves like we got to go back to the beginning. But it's hard sometimes to shift the microbiome because we don't have sterile guts anymore. We're not starting from the beginning. And so the shifts can be uncomfortable. So finding a perfect probiotic can sometimes take time, but we want to really avoid the histamine producing strains. So that's something easily you can kind of Google and just write them down. And when you're looking at a probiotic, you really want to flip it over and look at those strains. But there's a few that I really like. So I like spore-based probiotics, soil-based, spore-based, like Just Thrive, Megaspore Biotic. Like I think that those are pretty neutral for a lot of people. Now there are a lot of people that do get really bad die-off from them. And that's just usually a sign of things shifting. I also really like the Gut Institute's Bifido Maximus. I think it is a really good blend of bacteria, and it's completely histamine free as well. So those are kind of the ones that I always like lean on. I don't really like a lot of probiotics. I think a lot of them are actually possibly harmful or just really not effective. And so those are kind of ones that I find are tried and true. Terra Flora is another kind of spore-based probiotic. I think it has some phages in it as well. But that one can be really rough to get used to for some people. So I think it just depends. It can sometimes take like trying a few different ones. But yeah, if we have histamine issues, we really want to avoid the high histamine strains. And we need to be careful if we have endotoxin issues because we also don't want to just feed bacteria. Sometimes we'll have to go really low and slow while we're trying to kind of wipe out some bacteria all the while. Is water a primary source for minerals? Would it be dangerous to drink reverse osmosis water? I like reverse osmosis water that has minerals added back in. It's better to drink filtered water than to not, but we do need to be careful about flushing all our minerals. So if we're chugging water all day, then we should probably add minerals to it. But like I've talked about before, we should only drink water when we're thirsty, and we should really focus on mineral-rich beverages anyways. Yeah, it's good to make sure our water has minerals when possible, but it's not something that I super stress over. As a type 1 diabetic, are there specific things that I should be aware of besides keeping glucose balanced? I am not an expert on specifically type 1 diabetes, but Isaac Pullman is a really good resource. I think he struggles with type 1 diabetes personally, and he has a lot of great tips on his Instagram for type 1 diabetics. So I highly recommend checking his stuff out. Hi, thanks for doing these lives. My neurologist recently recommended high doses of B2 and magnesium glycinate for migraine prevention. I'm curious what your thoughts are on these supplements. Yeah, so if someone's deficient in B2, it can be very problematic for the nervous system, but yeah, it's very commonly used. That's actually a very kind of old school treatment, which is cool. And I love magnesium glycinate as well. So, I think those are great recommendations. Hello, are the allopathic Western medical tests that measure progesterone accurate? Yeah, if you're getting a blood test, but you have to get it at the right time, 5 to 7 days after ovulation. And it's not the same as estrogen, where estrogen can really store up in the tissues. I mean, I do think progesterone can in a sense, but there's less of a likelihood for it. What DAO enzyme would you recommend for histamine issues? Most of them are good. I just look for something that has the least amount of fillers. I think Seeking Health has one, which tends to be an okay brand. Eating FN for 6 months now, gained a lot of belly fat. Is this forever? Well, I talk about how when we're post-famine, we're really primed to put on weight, specifically cortisol weight. So if we have belly fat, then if we're gaining belly fat, we need to evaluate stressors. We need to evaluate if we're post-stress or we're still in stress. And then we need to evaluate gut health. So are we making sure we're, getting enough protein? Are we making sure we are balancing our blood sugar? And then are we making sure we are supporting the gut? And it's one of those things where, okay, when we say we've gained a lot of belly fat, is it gained a lot of belly fat for us, like what's normal for us? Because when we ditch running off of stress hormones, sometimes, our body's keeping the weight off simply using stress. And so when we chill out on the stress, a lot of times that's when we actually do gain some weight. And this is one of those things where a lot of people that have been doing FN for like over 2 years now have found that they are losing the weight. And then the people that aren't often have gut issues. Like, I'm just going to put it pretty cut and dry. Like when we can't lose weight, or we're just constantly gaining weight from eating a balanced, nutrient dense diet, then we usually need to really dig into the gut and our gut health. Does poultry and other non-red meats contain more PUFAs than red meats? Is this why red meat is pushed more in general? Yeah, in the pro-metabolic community, like red meat and ruminant animals tend to be pushed because ruminant animals have bacteria in their gut that actually change polyunsaturated fats into saturated fats. And that's why their tissues are a lot lower in polyunsaturated fats, whereas chickens don't detoxify, or really all poultry don't detoxify polyunsaturated fats well. So they tend to have a lot more PUFAs in their tissues. But then, like, you have to look at the cut of meat too. Like, if you're using like a chicken breast, for example, I mean, it's already very low in fat, and depending on how you cook it, like, you may be able to really limit the amount of fat in those foods altogether. Ideas for what can cause the back to get really itchy when in a hot shower. Sometimes histamine, like for people, heat intolerance and histamine tend to go hand in hand, and itchy skin and hives and stuff like that is usually due to histamine for a lot of people. I know we have talked about what fungal issues may be, but can you please talk about ways to improve these issues? I mean, it really does take digging deeper. Like, I mean, I could talk about this for 2 hours, which is why I'm developing a gut program to help people deal with these issues on their own, because it can be expensive working with a practitioner. I get it. Like, when you are doing all the testing, like, and buying all the supplement protocols, I think like me over the years, I probably spent close to like 30 to 40 grand on like just trying different things. And so it can be really frustrating. But to have like a cut and dry protocol can be very helpful, or at least like pointing, like, I wish someone would have just had a resource to like point me in the right direction, rather than just me having to experiment with a bunch of different stuff. So that's why I'm creating my gut program. But yeah, I mean, what people should start to do is, first of all, figure out what's working for them diet-wise. Make sure you're doing everything you can to support your adrenals. So that goes for eating every 3 to 4 hours to keep blood sugar balanced, making sure you're getting enough carbs, protein, and fat, and then lowering the food, like cutting out the foods that are really bothering you if possible. And then going a little bit further, focusing on minerals and sometimes using adaptogens can be very helpful. So once you're focusing on your adrenals, 9 times out of 10, a lot of gut issues get like monumentally better just by doing that. But then once you are doing that, sometimes adding in some antifungals can be very, very helpful. And that's the ones that I mentioned before, like SF722, caprylic acid, Pau de Arco. I really like monolaurin. There's a lot of different antifungals, natural antifungals, that can be very helpful. And then, we just kind of have to evaluate as we implement these things, like, are we getting really bad die-off? Because if we are, like headaches and rashes and things like that, we need to probably scale back a little bit and not push our body so hard. But it can take some work to uncover these gut issues. Hi, Jess. My temps and pulses have been great in the last 5 weeks, but the last few days my pulses dropped while my temp stays normal. What are your thoughts? Thanks. I would just be looking at like, what are some factors? Like, am I stressed? Did I maybe like unintentionally eat a little bit less? What about minerals? And also, what time are we in our cycle? So those are kind of some, like, I would just be trying to maybe find out why, like maybe sometimes something as simple as just me not getting a good night's sleep can affect my pulses for a day. Or if I get like multiple poor night sleeps, I don't sleep well, or I don't have good pulses. So I think it's just kind of evaluating like what's going on and what are maybe the factors behind it. What food to focus on while on and after taking antibiotics for a UTI? I really like trying. So it's one of those things where when we wipe a third of our microbiome out, oftentimes this is why a lot of people like that just do antibiotics over and over again, just find that their issues are getting worse and worse and worse because it's not getting to the root cause. I personally like to really focus on doing like cranberries, and doing the raw carrot salad twice a day. And then I really like a product. So I really like to use hibiscus tea, and then also I like to use black seed oil just for this purpose. But Just Thrive just came out with a supplement for urinary tract health called UT123, and it literally has like cranberry extract, hibiscus, and black seed oil, which are like 3 of some of my favorite things to use for urinary tract health. So I really like that supplement, and a lot of people have been talking about it, and I've been using it, and I actually really, really like it. But really, after antibiotics, we just have to remember that we've created space. So when we create space, we really want the right things to come back, and that's really just going to require us eating like good fibers, so roots and fruits, making sure we're keeping our blood sugar balanced, eating high quality proteins, and kind of just paying attention. I really like spore-based probiotics, things like Just Thrive or Megaspore Biotic. But like I said, everyone's really different. Everyone's gut is really different. And so what works for one person may not work as well for someone else. And so it's kind of finding what works. But we have to remember, like, especially if we get recurring UTIs, it often does have a big gut component, and can also have what was I going to say? Yeast can also be involved. And there's a lot of people who get die-off symptoms. So when they're doing like shifting their microbiome, and they can sometimes feel like they're actually developing a UTI. And so, when things are moving and mobilizing, it can get really uncomfortable. But yeah, when we create space, we just want to make sure what comes back, because it will grow back. We have trillions of bacteria in our body. Like, it will come back. So we just want to make sure it comes back in the right way. And that's usually just feeding ourselves the right things. What is causing short cycles, 21 days, and heavy, cloudy, painful periods? I'm not sure. I don't have enough information here to tell you, and I couldn't tell you regardless of what is causing that. I could tell you like some common causes of symptoms like that for a lot of women is estrogen dominance, having too much estrogen in relationship to progesterone, not balancing so that would be because they're not balancing their blood sugar, they're not supporting their liver. They're maybe not getting enough sleep, maybe not getting enough calories, not getting enough sunlight. So that's oftentimes like a sign of estrogen dominance. If cheeses have vegetable rennet or enzymes in the ingredients, is that okay? I don't understand the additives in cheese. So traditionally, it was always animal rennet that they used. And recently they started using vegetable rennet and enzymes, plant enzymes, which for some people can be actually irritating. They're food additives that can be irritating. For some people, it just doesn't matter. But for some people, it does bother them. So if that's the case, then you're looking for more traditional cheeses that use traditional animal rennet. So I hope that kind of helps. How much Ona's oil do you apply at once? I kind of eyeball it. Like, I usually use about like maybe 1/4 teaspoon or so. I got the Ancestral Thymus supplement to help with histamine issues. Would you just add in 1 with the beef liver supplement? I usually take like 3 or start with 3, just because usually the serving sizes are 6, I believe. I believe that's the case for that. 4 months into FN and got a really bad period that is ending with a UTI. Could there be a connection? There are reasons why. Yeah, so a pretty common symptom, like there are some women that get like UTI type symptoms, and then they go to get an antibiotic and they don't have a UTI. Now, some people, of course, do. But estrogen and, so estrogen and bacteria and fungus, they're all interrelated, right? So when we're at the end of our period, estrogen starts to rise. And when there is gut dysbiosis, oftentimes that estrogen can feed specifically fungus, but sometimes can mess with bacterial balance as well. And so, when people start to move estrogen and start to move junk out of their body, like some weird shifts can occur. So there could be a connection. Like women get all types of weird symptoms when they're detoxing, but it could also just be like a freak thing. Because remember, our period is a detox. And so when we're having these like first detox periods that I talk about in Fully Nourished, usually it's like the first 3 cycles. Sometimes it's a little bit longer than that. Or sometimes for some women, it takes a few months of prometabolic eating for them to really start to move some stuff. Remember, like when we're bleeding, we have stuff coming out. We have things that are detoxing. That includes bacteria is also coming out. And so if we're not being good about like our hygiene during these detox periods, there can actually be like, of course, some bacterial transfer. It doesn't always happen, but for some people, they're very sensitive to it. Would you do activated charcoal after antibiotics UTI? Is that helpful? I personally wouldn't, because it can be very like absorbent. So it would be absorbing a lot of, what's going on. Like I'm not trying to like prevent bacteria from going back. And usually like Flagyl is what they used for UTIs, I believe a lot of times. And so I would just let things kind of lie where they may, as long as I'm eating high quality foods, eating my raw carrot salad every day, possibly taking like a spore-based probiotic. Like I do that often. I haven't been on antibiotics for a long time, but yeah, I mean, I just kind of like don't stress about it and just make sure I'm like really rounding out my diet, specifically getting these like antibacterial fibers in. How would you support your body during a UTI? Digestive bitters, castor oil, detox lemonade. Thank you. Yeah, so like my kind of mindset is I'm always like, okay, I'm going to try the natural route first. And if it doesn't work for me, then I'm fine going and getting what I need. But I have gotten quite a few in the past couple of years. I mean, not quite a few, maybe like 1, 2, like maybe 1 a year. It happens sometimes. Like it happens. Like we have very sensitive parts. So what I do is I start pounding cranberry concentrate or like organic cranberry juice. And I also pick up a few cans of organic cranberry sauce. And I eat that with every meal. I'll sometimes make it if I can find cranberries, but it's hard to find cranberries. So I will eat a spoonful of that with every meal and snack. And then I also will do urinary tract probiotics. So I think it's called, the strain is called, let me just look it up really quick. Sorry guys. Sometimes I don't remember all these strains off the top of my head, and I gotta check it out. Oh yeah. I'm looking for, I usually take the thorn one. Or there's this other supplement called Urinary Tract Complete, but where is it? Oh, Thorn. It's called Floramend Prime Probiotic, and that one works really, really well. They also have this supplement called Uristatin that I've used quite a bit, and that one works really well. But now that Just Thrive came out with their UT123, I think I like that one a little bit better. But yeah, I usually just take a probiotic, look for like do lots of cranberry. Sometimes I'll do some horseradish, things that are just antibacterial. And then, like I said, I really like hibiscus and black seed oil, but now Just Thrive has that supplement that's a blend of 3 different ones. And then I also do something called, I've talked about this before in my lives, I do an apple cider vinegar rinse. So I dilute a small amount of apple cider vinegar with a lot of water in just like a large cup of warm water, and I just rinse down there. And I do it probably once or twice a day while I'm struggling with my issues. And I give it about like 3 or 4 days. But usually the cranberry combined with the probiotic, combined with the rinse, is very, very effective at getting the job done. And detox lemonade helps. I mean, I like to just add my cranberry juice to like the ingredients in the detox lemonade, but some people like to do a little bit differently. Been pro-metabolic for 5 months and have noticed major increase in cellulite. I think you said that when estrogen that has been in the tissue starts moving, it can cause this. Would you talk about this more? Yeah, so this is pretty common. A lot of women kind of see this as when it starts moving. And so this is where like making sure we're moving and focusing on our lymph system is important. Things like body brushing, making sure we're walking. Like there's a reason why I emphasize getting 10,000 steps a day and fully nourished. I'm not just randomly throwing you guys out a number. I'm like trying to get you guys to move so that you are moving your lymph system. And sometimes like, if you want to do like a mini trampoline, rebounding, like make sure you are moving and make sure you are pooping. And then sometimes women need to increase their fiber a little bit. So be good about your fiber. Like remember, fiber is important. Just because you're not eating a bunch of like grains and nuts and seeds and all this bulk doesn't mean you can't get fiber in. And I think a lot of women are thinking that, because I'm eating pro-metabolic, like I'm good. But make sure you're getting enough fiber. Like I'm serious when I say it, like fiber. If you find it too hard to get like plenty of apples and root vegetables and all these good fibers, then make sure you're having like 2 raw carrot salads a day. And I'm not talking just 1 carrot. I'm talking like 2 or 3, just because like if you're not going to get fiber from other sources, get fiber. So that's important to bind to estrogen and carry it out of the body, or it's just going to be reabsorbed. So those are some factors. But yeah, sometimes it's just because it's moving and we're not getting it out fast enough, and it's causing kind of that water retention. How long does it take of eating pro-metabolic for your metabolism to heal? Well, that depends on how long it's been just trashed. Some of us have trashed our metabolism since we were 12 years old, without maybe sometimes not knowing it. Some of us have had trashed metabolism since we've been born because our mom had trashed metabolism. So, to give like a time frame on it is kind of like, I don't want to do the disservice because it can take some time. It can take some time for sure. But sometimes people see like changes very quickly and some people don't. I have this other probiotic on the top of my head and I cannot remember it for the life of me. It's the ProFlora Women's Probiotic by Integrative Health. That's the one that I was thinking of in regards to the UTIs. The Integrative Health Women's ProFlora. What would you recommend for hyperthyroidism and nodules? What would be the root cause? I already take an anti-thyroid medication. So a lot of people, I think that Dr. Broda Barnes and also Dr. Ray Peat have like an interesting take on hyperthyroidism. They kind of talk about it being the rebound effect, like an overactive thyroid is in a response to an underactive thyroid. And eventually like the thyroid will go to an underactive place. It's just kind of like, it's imbalanced, like the metabolism is imbalanced because of stress. And so dealing with the stress is the most important part. Eating every 3 to 4 hours, dealing with our adrenaline and cortisol issues, and also exploring the gut component of it. Remember, like the thyroid's a really fatty tissue, and what likes to store in fat, guys? Like heavy metals, estrogen, toxins, even bacterial toxins are attracted to fat tissue. And so the thyroid is very susceptible to what's going on in the body. And if the body is very imbalanced, the thyroid is kind of like that canary in the coal mine. So kind of getting to the root cause, instead of just looking at it as like a thyroid issue, it's usually a whole body issue because the thyroid is the metabolic regulator of the whole body. And so really diving deeper into what's going on. And then also like a lot of people are being diagnosed with hyperthyroidism without looking at a full thyroid panel, which I just think is crazy. They're just going off of like TSH and just like regular T3 and T4. And I really think that people need to get their reverse T3 checked, their free T3, their free T4, their TPO antibodies for Hashimoto's, possibly like their thyroid binding globulin, because remember, that's like something, you can have a lot of thyroid hormone in the blood and your thyroid binding globulin is through the roof. So all that thyroid hormone is being bound to, and you still have hypothyroid symptoms, but just because you have all these hormones in the blood, remember guys, the blood is a highway for hormones. That's all it is. And so it's not always indicative of what's going on in the cells. And we always need to try to get as full of a picture as possible when it comes to issues like that. Can chronic congestion, thick green stuff, be all gut related? Suspicious of mold in the home, but don't want to dismiss that. My gut issues are the cause. Yeah, if you're suspicious of mold, that can be a huge cause. Remember, like mycotoxins and fungus and mold like love each other. So a lot of times when you have mold in the home, you have mold in your gut and vice versa. So like, because mold spores can come in, we're always breathing them in. So I wouldn't discount it could be both. A lot of people with mold issues get chronic gut issues because they're breathing these mold spores in and then it's causing like a fungal infection, or they just have really bad mycotoxin issues. But, it's hard to say. Sometimes it can just be both, but sometimes it's actually easier to test for mold than it is to test for gut issues. And that can be very helpful. I've been doing Fully Nourished for 6 months. My PMS mood swings have disappeared. But recently I now have the same PMS symptoms from my period till ovulation. Is this common or progress? Now, yeah, so it's weird because I've actually had 2 conversations with friends who, like a lot of my friends are in Fully Nourished or eat pro-metabolically now. And she was saying the same thing, like she was doing the detox lemonade during the luteal phase and it really helps clear up her PMS, but then now she is like having more symptoms during ovulation. And so remember that our estrogen really starts to rise right after our period ends, or even it can start to rise up, like kind of right as it ends or right before it ends. And so if symptoms are starting to get worse as estrogen is rising, then my question is always like, are you supporting detoxification there as well? Because sometimes we need to offer some extra detox support as hormones shift. So I don't think there's a perfect answer for that. It could be progress, it could be something else, but like I always say, like if I'm having a symptomatic time, like it's more about, I know like some people are just trying to achieve perfect health, and it's actually very difficult to achieve that in our modern world, especially if we're like living our life. So, it would be disingenuous for me to say like, oh my gosh, my cycles are always amazing. Like I do have these occasional times where my cycles are like, I'm just like, what's going on? Like, I'm just not feeling it right now. And then I start to just pay attention to patterns and I'm like, okay, I'm real with myself and self-aware enough to know like, okay, I haven't been doing X, Y, Z right now, and this is why this is occurring. Now, if you can't find any pattern, like for example, like not eating enough or not getting enough of the raw carrot salad, not getting enough fiber, maybe you change something up in your diet, maybe you tried a new supplement, then sometimes there's just shifts that are going on, and we need to acknowledge that in our body and maybe try to support those as best as we can. But obviously knowledge is power. So since it's leading up to an ovulation, maybe supporting your body during that time is now more important than the second half of the cycle. Been having nights where I'm super cold and then other nights where I wake up sweating like crazy. Could this be thyroid related? Yeah, it could also be stress related. Like remember, our thyroid is our metabolic regulator, but a lot of people who have like adrenal issues, like high cortisol, high adrenaline, they're running off of stress hormones. They like have hot flashes, they can't sleep well, they have night sweats, they have a really hard time like regulating their temperature, their hands are always cold, their feet are always cold, they're always cold, hot, cold, hot. So that's usually like adrenal type issues. Dang it, I lost my place. It's bound to happen at some point. Oh, here we go. I've heard you mention your Nature's Multi-Tea before. Would you mind sharing it again? I can't find the YouTube live. I heard it on before. Yeah, I just use oat straw tea, nettle tea, and red raspberry leaf tea. And then I usually like just eyeball it, like probably like a fourth a cup in like a large jar, and then just fill it up with water and just let it sit for a day or two. And then just usually have like maybe like 6 or 8 ounces of that in the morning. I go through like different morning elixirs. Like sometimes I'm all about that like warm lemon water with a ton of salt in it. And then sometimes I'm just all about this weird, like very earthy tasting liquid multi. Have you tried functional patterns training? It's actually on my list of like something I want to invest in this year. I just like haven't been ready to commit, and I hate like buying stuff and just having it sit there. I want to be able to like put it into practice. And so it's definitely something that I'm going to invest in probably in the next couple of months. Hi, Jess. What causes high DHEA, and is there a way to lower it? I have PCOS and missing periods. Also, low progesterone, been eating pro-metabolic for a few months, and it's still elevated. Thank you. Yeah, so, adrenal stress is not always like an easy thing to figure out. We have to kind of get to the bottom of why our adrenals are so stressed out. But usually when adrenal hormones are high, we have to really support the adrenals with sodium and potassium and vitamin C. And also, sometimes adaptogens can be helpful. So, I highly recommend for some women to just kind of get real with themselves and use the app Chronometer and track a couple days of eating so that they're aware of how much potassium they're getting in their diet. Oftentimes, they are not getting enough, not even close to enough, which is about 5,000 milligrams. And that's so important for adrenal health. And I think just women don't understand how important it is. And so usually, adding in something that has a lot of potassium in it, or even adding like potassium supplement. I personally don't like synthetics. I like using like coconut water powder, coconut water, getting plenty of juice, and also like goat's mineral whey. And then I also really like to just make sure I'm getting plenty of salt. And this is often a largely overlooked part. And then vitamin C, I think sometimes supplementing it can be necessary for a lot of people. So that would be my first thing, is like, are the adrenals still really stressed out? And then missing periods, remember, like if we're not ovulating, we're not making that progesterone that's there to protect us from stress. And so we're really not as resilient to stress or estrogen. And this is where like it can be helpful to sometimes explore bioidentical progesterone with our practitioner and say like, is this something that I could possibly use to get my period back and help lower stress? Because at some point, like we have to throw a wrench in that vicious cycle to get it to stop so that we can start ovulating again and we can actually start that healing journey. White spots on nails, ? I don't know what the question is, but usually it's mineral related. I often get them after like very stressful events or stressful times in my life, which makes me know like, okay, magnesium, sodium, potassium, zinc, those types of things, like my body's burning through those minerals a lot faster than I'm replenishing them. I know you don't recommend a vitamin B complex. What specific B vitamins should we be incorporating into our diets? All of them. This is why I'm such a proponent of beef liver and oysters. And I know you guys like love to be annoyed at me, but it's so important. There are certain B supplements that I do like. Like I really like Health Natura's liquid B supplement. But I do think like niacinamide or vitamin B3 is very helpful. B1, B2, B5, like pantothenic acid, but specifically like B6 is so important because it affects the way that your body uses magnesium. And that affects how your body detoxes iron and uses copper. So B6, very important. B12, obviously, like all the Bs are important, but those are kind of my faves. Thoughts on xylitol as a sweetener in toothpaste? I don't think xylitol is bad at all, especially if you're not swallowing it. But it can like definitely give somebody the runs if they have lots of bacterial issues, if they like consume it. Do you make your own magnesium chloride lotion? I sometimes make my own magnesium chloride spray. I just get the like ancient mineral magnesium flakes and dissolve it in hot water. But if I do the magnesium lotion, I just buy the ancient minerals one. I don't like it from like moisturizing. It always leaves that like weird chalky feel on my skin. So I often use it at night, like right before I go to bed. Or I'll do it in the morning because it's a little bit lighter than my regular like beef tallow concoction. My husband has fine, thin hair and is starting to bald early. He's not super into healthy things, but do you have any simple suggestions that might help him? I've been putting collagen in his coffee. No, hair loss is not simple, especially for men. It's usually like thyroid, high stress. Oftentimes there's estrogen involved and endotoxin. Like it's not a simple fix. If they're not willing to like do the work, then oftentimes like there's nothing you can do. I mean, yeah, red light therapy can sometimes help. Like I've had a few followers tell me that the red light therapy has really, really helped, just pointing it on their hair. But usually it's not enough to fix a hair loss issue, just because especially if it's in the genetics. You got to get to the bottom of the issues, and that requires, work, and also requires dedication. I've eaten meat my whole life, eating pro-metabolic for about 5 months. Suddenly, red meat kind of grossing me out. Thoughts on this? Usually if meat or dairy or just animal products in general are grossing you out, sometimes it's digestion related, like stomach acid is low, or like digestion is off. So supporting digestion with like some diluted apple cider vinegar, digestive bitters, stuff like that can be helpful. Are dark spots on the skin starting to appear while going pro-metabolic, sign of PUFA and estrogen detox? So some people say that they are getting some like brown spots on the skin, but if that's the case, like sometimes we got to slow down, and we also need to make sure we're taking a step back and getting all the nutrients we need. When I emphasize vitamin C and vitamin E, it's important because they are antioxidants. When we have all this junk that's stored in our body that starts moving, our body requires nutrients to neutralize these things and break them down. And so that's really where I think a lot of people are kind of misstepping, is they think like, oh, I'm just eating all the things. And like, when you speed up your metabolism, you also have a lot of nutrients that you need to make sure you're getting. This is why I mentioned Chronometer and Fully Nourished. And I use it as a tool. It's not just about tracking macros. It's about making sure you're getting enough and just being aware of like, oh, wow, like I'm not really getting plenty of vitamin C every day. Or I'm not getting, just because you're drinking orange juice doesn't mean you're getting plenty of vitamin C. It's a good step from not getting any vitamin C in your diet. But I'm just kind of making a point that I think a lot of women go pro-metabolic and they expect their issues to just be like, bing, like go away, everyone's perfect. And I think there are a lot of people in this space that are doing people a disservice by saying like, I started eating sugar and like all my issues went away. And it's not really how that goes. It's important to balance out your thinking and balance out your diet and focus not just on the sugar, but also making sure you're getting the protein, making sure you're eating the saturated fats, and getting the nutrients as well. But dark spots on the skin, yes, sometimes people are moving PUFAs. I struggle with TMJ, jaw joint disorder. Any ideas if I'm missing certain nutrients? Stress definitely makes the tension worse. Yeah, a lot of women who have TMJ actually have pelvic floor dysfunction because the pelvic floor muscles and the jaw muscles are like very intimately connected. And so a lot of women have like overly tight pelvic floor muscles, or some are loose and they're not realizing that they're clenching all the time, and it's directly affecting their jaw. But yeah, stress oftentimes makes it worse. Magnesium can very much help with like just muscle tension overall. But that's usually like a puzzle piece that a lot of women are not aware of, is the pelvic floor connection. Let's see. What do you think about Daisy fertility tracker as a way to practice FAM? I would never trust a Daisy fertility tracker ever with my life. I think the old school way is so much more effective, like Daisy and like natural cycles, like all of those rely on an algorithm. And I personally don't like trust an algorithm to tell me how my body's ovulating, to predict if my body's going to ovulate, because their algorithms are usually based on you ovulating around day 14. And so let's say you have a really stressful month and you ovulate early. Remember, sperm can last in the body for 5 or 6 days. So you thought you weren't in your fertile window and you were. So it's just one of those things where like, I would never trust an algorithm. Like I only trust myself. And the way that I just think it's not a good idea to trust an algorithm. There are many people that like have no problems with it. I just personally wouldn't do it. I like temp drop, or just like old school way. Would you recommend gelatin gummies with eating grass-fed beef, lamb, and shrimp and fish? Yeah, I think everyone should be doing gelatin gummies. But yeah, it's an easy way to get some gelatin in while you're eating beef. I think you mentioned oysters once per week is enough. Is 1 can at a meal too much? No. I think that eating like oysters once a week is enough. Some people like need some more consistent nutrients, for example, like they need some zinc every day. And so like taking an oyster supplement can sometimes be helpful to get like those mineral levels back up. But I personally don't do oysters like more than once or twice a week. Yes, the reference sheet idea would be incredible if you can. I struggle with finding practitioners who do not recommend fish oil and or vitamin D, and they look at me like crazy when I say it's not good. Yeah, I don't do that. Like I'm not like trying to find a practitioner or a doctor that's, that's gonna believe me. Like I don't even bring it up. Like they tell me to take fish oil and I'm like, okay. And I just like don't do it. Hi, Jessica. Does OJ help with proper absorption or encourage all iron absorption? Trying to understand if it should be avoided with high iron meals. When I was vegan, it was encouraged. Yeah, so vitamin C helps your body utilize iron and can increase iron absorption, but I believe it has a lot to do with the bioavailable copper in it as well. I personally don't avoid it that much. Doesn't really bother me. But for some people, I guess if they think that they're iron overloaded, then that could be a possibility to maybe avoid it at meals. And if you're trying to avoid iron absorption at meals, drinking coffee with meat can be very helpful. Also, Kate Deering mentioned cocoa can block iron absorption. Have you found that in your experience? Yeah, it has the tannins in it, like similar to black tea, which can bind to a lot of different minerals. So yeah, cocoa can be helpful as well, like hot chocolate. Do you like dulse or seaweed for iodine? Yeah, dulse is like, it's nice to buy the kelp flakes or the dulse flakes because it can kind of be like you can like just salt your food with it, and it or I just add it like on top of regular salt. But yeah, I mean, it can be a good source of some iodine. Probably not a whole lot, but it can be some iodine, Came out of veganism a year ago with tons of dental decay. I'm eating pro-metabolic now, including a fair amount of raw dairy. Are there any supplements to help with dental recovery? I'd be looking at like getting plenty of vitamin A, and then I wouldn't supplement vitamin A. I should like clarify that, just more from the diet. Vitamin K can be something that is very helpful. Yeah, vitamin K or like butter oil or something like that is usually very, very helpful. Just like continuing with the fat soluble vitamins and animal foods can be, it can just take some time, and that's kind of the hardest part. What could frequent urination during the day be a sign of? Usually like adrenal, like high adrenaline, high stress, just constantly peeing out your minerals. It's a diuretic. Adrenaline's a diuretic, so that can be a sign of that. Hi, Jess. In terms of gut dysbiosis, what do you think of something like a fecal transplant? Instead of trying to reset the gut bacteria, why not transplant it from a healthy gut? If you can get one, they're kind of difficult to get. I also don't necessarily like trust them quite yet because, they say that they vet them really, really well, but because I know like how hard it is to test a gut, there's no perfect gut test out there. I'm always questioning like, what are they testing? They're probably looking for like parasites and worms and things like that. But if you could get like some really good like baby poop or something like that, like I would be down for that because like I know it's like not a disrupted gut, but I'm not down for just some random person. Yeah, so I think it just depends on the context. Like I'm not against it, but I'm not like, I have like my worries about it for sure. I've been taking the Perfect brand desiccated liver. Oh, and I should just rewind and say like I've had a lot of clients that have gotten fecal transplants. And they had such bad dysbiosis that it didn't work. So, it's just one of those things where I don't necessarily like gut healing is like a layers. Like I think of it as like an onion, and I look at it as like a large over time onion. So like a 6 to 12 month onion that you just have to peel back a layer and then something pops up, and then you peel back a layer and like something else pops up. And it's just one of those things where it just takes time and consistency, and people are just so used to quick fixes. They're not willing to do this like 2 steps forward, 1 step back. that it takes to really heal a gut. It's very difficult because you're dealing with like a huge ecosystem, and then oftentimes you're dealing with stress, and then you have like real life to think about as well. So, but there are some people that have like really bad issues that fecal transplants can work really well for. I've been taking the Perfect brand desiccated liver. The daily recommendation is 4 capsules. Is this too much? I just look for, like, I'm trying to get an equivalent of what would be like 4 to 6 ounces of fresh liver a week. And usually with supplements, I think like a lot of times they're like the equivalent to 1 ounce, but you just have to check with the brand. Is it always important to drink coffee when eating liver? Sometimes I don't eat it till dinner and I don't want to consume caffeine at night. Thanks. No, it doesn't matter. Just some people do it because they don't want the extra iron. Do you like or have an opinion on bentonite clay externally for detoxing? I really like it for like external stuff. I often will take a bath with it. I really like Enviromedica has this like detox bath, drawing bath. It works really well. Like, dang, it makes me feel like really drained afterwards. And then I like to use it like for armpit, detoxes when you feel like you have like really smelly pits. Hi, Jess. I'm pregnant and there are foods that I'm disliking to the point of gagging, not liking carrots much, neither mushrooms. I heard green apples could help with endotoxins. Is this true? Thank you. Yeah, like apples can be helpful for endotoxins. Just the pectin can be helpful. Is there a deodorant you'd recommend? The reason why I'm like struggling is I use milk of magnesia a lot. Or I use like a probiotic spray that I make with EM1, which is like a microbinoculant, which helps kind of neutralize things. I like Schmidt's. Like Schmidt's is okay. Native is not the greatest, but I've used that before. I think it just like really depends on the person too. Like some people really don't, natural deodorants don't always work. I also like Primally Pure. Like that's probably my favorite natural deodorant. It's just a little bit bougie, a little bit expensive, but I do like Primally Pure. I find that especially their activated charcoal deodorant, it's kind of like a more manly scent. It just works so well. My friend is allergic to onion and garlic. She gets painful intestinal bloating. Is this related to a gut out of whack? Yes, it's usually a sign of small intestinal bacterial overgrowth because those foods are really high in FODMAPs. Hi, Jess. I had a lymph node in my groin removed 2 weeks ago, and my entire leg is now super swollen. Any recommendations for both healing from surgery and helping lymph flow? Just supporting the lymph system overall. I would just work on like helping with drainage, like moving, body brushing, walking a lot. Vibration plates can be helpful if that's something you want to invest in. Rebounding like on a mini trampoline can be helpful. Just kind of depends on like what you kind of want to do, but movement is the most helpful thing. And like gua sha can be helpful as well. Just Google or YouTube gua sha, just the scraping. It can be really helpful. I'm considering taking oregano for fungal and oxalate issues. Anything else you'd recommend doing when you're trying to heal oxalate issues? You've mentioned minerals before, but those make me sick. Yeah, just going slow and supporting the kidneys as much as possible. Like not going too fast. Like I know some people are just like, I want to get this issue out of the way, but when you go too fast, too hard, it ends up stressing the body out more, especially like I see this pretty often with people that are extremely sensitive, like the minerals making them sick or the minerals making their teeth hurt or the minerals, giving them symptoms. And the problem with that is the adrenals need minerals. And so you can't push a hardcore detox when your adrenals are already very, very sensitive to stress. And so it's really important to just understand that slow and steady wins the race in cases like that. And it's just about like going very, very slow. I really, and making sure you're pooping regularly. Like I cannot emphasize this enough. People start these like antibacterials or these antifungals or even like antiparasitics. And then they are like super constipated for days. And I'm just like, that is like a nightmare. So make sure like you're pooping. At what point do you think it'd be a good idea to supplement progesterone? Um, it just really depends on the person. I feel for most people that are hitting a wall, like that's really a good place to possibly consider it. Like people that are just like still anxious during their luteal phase, not sleeping well, feeling very irritable, maybe can't focus. Remember, like you have progesterone receptors in your brain, your breasts, your liver, your ovaries, your uterus. So a lot of women who are low in progesterone don't realize that these organs are being affected all the time by not having progesterone, because now those organs are very susceptible to cortisol. So, I personally think that a lot of people can start it and experiment with it, and they usually notice pretty fast if it's making them feel better or feel worse. As long as people are balancing their blood sugar, that's all that matters with the progesterone, because it does speed up the metabolism. I tend to spot for 3 to 4 days before and after my period. The color is usually brown or sometimes black. I've tried progesterone, but that hasn't helped much. Any thoughts on improving spotting? Usually it's an estrogen thing, like low progesterone, high estrogen. Just improving like overall hormone balance can be very, very helpful. I really like some of BioRay's supplements. BioRay has a few of these like herbal tinctures to help with like hormonal balance. Like during the cycle, I think it's called like flow or before the flow, and then they have like after the flow. Those can sometimes be very helpful for some people if they're trying to kind of like get things balanced out. Just to double check for the detox lemonade, it's a tablespoon, not a teaspoon you use of chlorophyll, right? Well, if you're just starting and you've never done chlorophyll before, you might want to start with a teaspoon because people can get some serious detox from it. Hello, I'm interested in information about sunflower lecithin. It helps with avoiding clogs while nursing. Is this considered a PUFA? Should I stop taking it? It can sometimes be irritating for people's guts, but it's just the choline in the sunflower lecithin. So a lot of women are not getting enough choline. I love following Noelle Covery on Instagram because she's like breastfeeding, and she always talks about like pro-metabolic eating for breastfeeding. And she like her little famous like egg yolk coffee is very popular amongst breastfeeding moms because egg yolks are very high in choline. So it's just the choline that's helping. And sunflower lecithin is a great source of that. Can you ovulate but LH too low to show on an ovulation test? I became pregnant in October while I had hypothalamic amenorrhea 1 year. I'm no longer pregnant and my cycle has returned, but still not seeing LH show up on the test. Luteinizing hormone is not, one of the, a lot of people really emphasize, it's really weird how the fertility community just like emphasizes luteinizing hormone so much, but luteinizing hormone is just one of the hormones in the cascade, and it's not the only thing that is indicative of ovulation. And I think it's a really crappy way to track ovulation because I just don't like it. Like, it's just not a great way to track if ovulation's occurring or not, especially for people who have like a really irregular cycles. So remember, like, it's really weird when I hear stories like this because, I mean, it's amazing. But, there's some women that just they lost their cycle for a long time and they just happen to get pregnant on that first ovulation, because ovulation will either always result in a period or a pregnancy. It's impossible for it to not result in a period or a pregnancy. So it's just very interesting when I hear stories like this. But luteinizing hormone is not the only thing that we want to be watching. This is why the fertility awareness method is so helpful for tracking ovulation. Looking for that temperature spike, watching that cervical mucus, checking that cervical position, and then getting our progesterone tested, 5 to 7 days after our supposed ovulation can be a helpful indicator to confirm that the ovulation did happen. So LH strips can be helpful, but I don't think that they're helpful for everyone. And sometimes women are ovulating way later in their cycle or way earlier than their cycle. Can you post what I eat in a day vlogs and workouts on YouTube? Yes, I plan on doing that. It's going to be like a couple of months before I get around to that. So right now I'm just going to like keep doing some videos on different topics, but yes, I will be definitely doing vlogs in the future. Hello, what do you recommend to treat SIBO without using doctor prescribed antibiotics, diflucan? It just depends on someone's situation. Like, I don't necessarily recommend anything. There are some like herbal blends that have been shown to be just as effective, if not more effective, than antibiotics, and that includes like the combination of either FC-Cytal and dysbiocide, which is by Biotics Research, or Candibactin AR with Candibactin, I think it's like CR or something like that, by Metagenics. Sometimes that works for people, sometimes it doesn't. But remember, guys, like SIBO is stress-induced bacterial overgrowth. It doesn't just go away by killing the bacteria, because we have to ask ourselves, why did the bacteria get to where it doesn't belong in the first place? And it's often because our whole digestive system was broken down because of thyroid issues and stress. And so if we try to kill the bacteria, that's cool, but eventually it's just going to come back. Hey Jess, thanks for all you do. What is the benefit of boron? Took HTMA and it's super low, 0.5. What is your favorite supplement or food to support? So like boron helps magnesium retain in the cells. So oftentimes when people are very low in boron, they just are not keeping magnesium in the cell very well. So it's a very important mineral. It's often like, it's kind of hard to get in foods. You can get it specifically in like raisins. I know that's like kind of a random food, but raisins are very high in it. So like organic raisins, but it's hard for me to eat enough raisins like to make a difference. So depending on people's like labs, usually boron supplements are about 3 milligrams or so. And then there's higher doses ones like Hakala Labs, which are like 30 milligram. They're a lot higher dose. So I like Life Extension, just like any regular brand that doesn't have a lot of fillers, like any trusted brand, like Thorne, Life Extension, those types of things. Trace Minerals Research, Edon Minerals, EIDON. But Hakala Labs is a helpful one for when we need a little bit of a higher dose. What causes heavy legs and pain in ankles at night? It's different for everyone, but a lot of people report that magnesium really helps with that. Mouth taping helped my TMJ. Yes, a lot of people sleep with their mouth open, and that can really change the whole jaw. I have insulin resistance and need some help with high fasting blood sugars. Yeah, so high fasting blood sugars, remember guys, that if we have high fasting blood sugars, our body is now manufacturing sugar because our blood sugar was very imbalanced during the night and we have really high stress hormones. We need to manually balance our blood sugar by eating protein, carb, and fat every 3 to 4 hours and eating a very balanced bedtime snack. This usually helps get them down. Can we do all the normal detox things during our period, like castor oil packs, coffee enemas, etc.? Some people say no, and so like I try to be, just be careful about it. Do I heed that? No. I do coffee enemas during my period, castor oil packs during my period. Yeah, I don't worry about it. It doesn't bother me. It actually helps me. And like I know like a remedy in the 1920s or 1930s for like period pain was literally doing an enema. Like one of my grandma's friends told me that she was telling me that her mom would have her do an enema when she had period cramps when she was a teenager. I was just like, that is so crazy. Like, we would think now if our moms told us to do an enema, you'd be like, what? But that was pretty common back in the day. So that was a long way of me saying like, I do them. Are they safe? Like I'm still here. So, but some people say no. Thoughts on beef thyroid supplementation? I've heard you mention kidney and thymus, but never thyroid. I mean, some people like it and they like think it's like helps warm them up. I personally have used like natural desiccated thyroid, the one prescribed by the doctor, but I've never tried like ancestral supplements type thyroid, but I don't see a problem with it. I think like most organs can be beneficial for some people, just depending on what they need. I have night sweats starting 3 days before my period. Once I start my period, it goes away. Also, I'm only 26. Is this a high estrogen problem? Yeah. Most people that have high estrogen also have like high adrenaline, high cortisol, which can definitely contribute to like night sweats or hot flashes, things like that. But usually getting our progesterone levels up and also just balancing our blood sugar and then like working on magnesium and things like that usually really, really helps. If you haven't taken my Mend Your Cycle course, you might find a lot of helpful information in there. Would you avoid working out at night? Oh yeah, 100%. I don't think like it's not going to benefit us in any way. Like our natural circadian rhythm is like this in the morning and over the course of the day goes like this. We want it to be low at night so we can go to sleep. But if we work out, we're going to have an immediate cortisol and adrenaline spike. And it's like, then it's going to take a while for it to go down. And I just don't really like, it's going to disrupt our sleep. And I just don't see the reason for it. Like, it's not, it's not going to help us lose weight. It's not going to really, like, we're not going to see a lot of benefits that we're trying to achieve with exercise from it. How much grams of fat and carbs would you start with for a bedtime snack? So my snacks, like I'm pretty regimented with my macronutrients just because for me, like I work well with structure. And since I've overcome like my eating disordered past, I like to track macros. It helps my structure. So, for me, I look at macronutrients as like making sure my body's getting enough and keeping myself accountable rather than like, oh no, I'm getting too much food and I'm gaining weight. Like I've really learned to separate like macros from like my body image. So with that being said, like I just want to say that it's not right for everyone, but for me, like I'm pretty regimented with my goals. And you guys know I'm also like loose in my head in the sense of like, I'm not strict with myself, but I like to have some guidelines. And so I aim for, so I have 3 meals a day and 3 snacks. And my meals always have 30 grams of protein. They always have about 50-ish grams of carbs, maybe 60. And about 10-ish grams of fat, 10 to 15-ish grams of fat. And then my snacks are always going to have 5 to 10 grams of fat, about 20-ish grams of carbs, and about 15 grams of protein. So that just kind of like, I'm looking at my overall calorie intake, which is usually around like 2,200 to 2,500 calories. And then I break it down that way. But yeah, it's going to be different for everyone. But I usually try to do like 10 to 20 grams of protein ballpark, 20-ish grams of carbs to 30-ish grams of carbs ballpark, and like at least 10 to 15 grams of fat ballpark. My doctor put me on Prometrium, bioidentical progesterone. Yeah, but I've heard it could be peanut oil in it. Would you recommend switching to a different progesterone, or is that okay taken with vitamin E? I mean, minimal amounts of stuff, guys, is not going to be a problem. I don't think we need to stress about every tiny little thing, because if we could like visibly see every tiny little thing that's affecting our health, I think we would just go crazy. But yeah, I mean, sometimes people do react to a small amount of additives, but if you're not reacting to it, I don't really see like a need to worry about it. Do you mind to explain the importance of the phosphorus to glycine ratio? I remember hearing this in reference to eating gelatin on with muscle meat, but I would love to hear the why behind it. Thank you. Yeah. So when it comes to muscle meats, like, well, traditionally we would eat the whole animal, right? We would often stew meats, and it was usually joints, right? So like think of like a lamb shank or something like that. It's like the joint of the leg. And so the whole joint was in that meat, and you would cook it on the bone, and you would usually like stew it. So the gelatin would kind of seep into the meat, right? So we've kind of like, we've almost evolved in the sense of like, we've always eaten animals this way until very recently. Now we go to the store and there's like a package of ground beef, and like it's been extracted from the bones, separated from the tendons. Like we are no longer cooking our food in a very traditional way that we once did. And so that's where we're trying to mimic that as much as possible. Like it would be awesome. Like honestly, I encourage people, like if they can get these traditional cuts of meat that are on the bone in the joint and slow cook them and slow roast them, that's the best way to go about it. But if you're not doing that and you're like having a steak, or you're having like a chicken breast, or you're having just some ground beef or something like that, then it's a really good idea to combine it with gelatin because it has that glycine-rich amino acids. When it comes to amino acids, we really need a balance. And muscle meat specifically is very high in like cysteine, methionine, and those are amino acids that are important. But if we're getting too much of them and we're not getting enough of those building amino acids like glycine or leucine, then we create this almost amino acid imbalance. And then this can drive inflammation, and we don't have this to kind of balance out the inflammation. So, amino acids kind of pool in the body. Our body takes all the individual amino acids and combines them to make, you can think of them like Legos almost, like to build whatever structures it needs. And we want to make sure we're getting a balance of all of them. I hope that kind of makes sense. I cannot afford oyster supplement, and it's hard finding oysters where I live and are not cheap either. What other thing could I take to get iodine and zinc? Thank you. So all mollusks and all like seafood, shellfish is moderately like has these things. So clams, oysters, what other shellfish, like scallops, even shrimp or prawns, lobster, crab, all seafood is very rich in these foods or in these nutrients. So like my tip would just be to try some of these foods to get some of these foods in. Will you ever come out with a cookbook recipe ebook? I might. I just don't really I don't think that helps people in the sense of, you have to know why you're eating the way that you are without just eating a specific way. Because if you don't, then you can't troubleshoot and you're not really taking control of your own health. You're just letting someone else decide for you what to eat. Now, I will say Fallon's meal plans are really, really great. And she writes these meal plans from a very good pro-metabolic perspective. So if you're looking for something that has more structure, I highly recommend checking her out. But yeah, I don't know if that's something that I will ever do, just because I like to educate people on the whole why, and I want them to have the whole transformation rather than just be oh, I'm just eating this and I don't really know why I'm eating this way. Hi, Jess. Thank you for answering so many questions. I have a couple odd symptoms when estrogen rises: sores inside nostril, pelvic floor sags more, and inner thigh acne. Thoughts? So a lot of, so if the sinuses, and I always look at the mucous membrane, sinuses, just the digestive system as a whole. If anything is going on with that, I usually automatically just resort to is there gut issues? Estrogen does cause tendons to stretch, all stretching of all ligaments, including, obviously our pelvic floor. And so just being conscious of that, that's going to, of course, affect our pelvic floor. This is why estrogen dominance can lead to incontinence. And then inner thigh acne, that is a very interesting, I would wonder, remember we have lymph nodes in our groin right there. And lymph nodes are a big part of detox. So, people that have poor detox get acne on all their lymph nodes, specifically that kind of chin and jaw acne. But I rarely hear of inner thigh acne, but I'm wondering if that's similar, if it has to do with the detoxification. My doctor wants to put me on thyroid meds during pregnancy. What would you do if you were pregnant? I don't really want to take them. It's one of those things where we have to just kind of determine, as estrogen rises during pregnancy, a lot of times, if we already have a really impaired thyroid, our body can't handle pregnancy, and our thyroid really takes a hit. This is why, I'm such a big proponent of prepping the body for pregnancy, prepping the metabolism, because, our hormonal balance now is going to change during pregnancy, and our body's going to have a lot more stress placed upon it. So if we're already in pregnancy, it's kind of one of those things where we just have to decide. And if our doctor is saying yes and we feel wary about it, then sometimes we need to get a second opinion. but it's important to make sure we have enough thyroid. That is important. But if it were me, I would be opting for a natural desiccated thyroid or exploring that with my doctor. Because if it's T4, if it's synthetic T4, remember synthetic T4 still has to be converted to T3 in the liver and the gut. And if it's already not converting well, then we're going to still have a problem. I keep finding out I have cysts in different places of my body. Adenoids in the nasal pathway, a bunch of tiny cysts all over my thyroid, cysts on my ovaries, a cyst in my wrists. What do you think? So what comes to mind, like obviously estrogen. Estrogen likes to drive growth and cellular proliferation. So that's the first thing that comes to mind. Like what's going on with detoxification, what's going on with estrogen, like how is the body detoxifying it? That's kind of like the first thing that comes to mind. Second thing that comes to mind is like what's going on with how's the gut doing? So this is more like fringe, but there are a lot of people that talk about parasites being something that kind of cause problems, especially if these problems are like popping up and then like going away and then popping up in a different area in the body and going away. Not saying that that is what it is or not. I'm just kind of like, that's another thing that possibly comes to mind. But yeah, usually like if I'm looking at growths, like I find that oftentimes these cysts, because I've had quite a few clients that have different types of cysts, like the Bartholian cyst or the cysts on the tailbone. And we really started to make a connection with a lot of them that they get worse during the luteal phase. They definitely get worse when estrogen is at its worst. Now, do they go away when estrogen isn't at its worst? No, but they get pointedly worse when that's happening. And then of course I would explore iron 100%. I would be exploring iron because that iron can be also a driver of just oxidation stress, and that is oftentimes like problematic. And iron and estrogen they kind of like feed off each other in a way. You're kind of like, is the symptom this or is the symptom this? And it's like usually both, like it's kind of driving the same issues. So if you haven't taken Morley Robbins' like Root Cause Protocol 101, I highly recommend that course for anyone that is struggling with like mystery issues. I think like that is a really important component to pro-metabolic eating. Like it's a deeper dive into the mineral component of it. This is indicative of how can I help break them down. So some people like to do systemic enzymes. Like I have heard of people using systemic enzymes that for cysts sometimes. Now, some people have seen a lot of benefit from using castor oil packs topically. Now, that's not everyone, but I've seen quite a few people that find that like doing castor oil packs really helps, or doing like drawing salves. So like bentonite clay or something like that, like doing like a clay pack. But also like getting to the root of what's driving the growth. And that's where like, maybe dialing down on detoxification and also elimination might be important. So like reevaluating, okay, how's the liver doing? How's the gallbladder doing? And then, once bile is flowing, is it being carried out of the body? So making sure you're kind of evaluating if you are getting enough fibers. Lots of roots, maybe, adding in a couple of apples a day, maybe even up to like 4, doing raw carrot salad twice a day, possibly activated charcoal, making sure that that stuff that's coming out of the liver is being bound and carried. So those are kind of the things that are coming to mind, is like, and that will apply to estrogen as well, but that applies to all toxins and all junk. When our liver and our gallbladder are excreting these things, it needs to go somewhere and it needs to be pooped out. And so like making sure we're pooping regularly. And if we're not, especially if we're in these like weird situations where we're struggling with symptoms, sometimes taking something to help us poop can be helpful. I really like Cascara sagrada or rhubarb extract. BioRay has like a good poop encourager. that has rhubarb extract in it. Just something that's gonna keep the bowels moving. And then like always exploring iron, exploring making sure we're removing these toxins from our body is important. I do have a liver disease. I wonder if my thyroid issues cause my liver issues or my liver issues cause my thyroid issues, or if that's the wrong way to think about it. Yeah, so I didn't want to mention that. I didn't want to mention that publicly if you hadn't disclosed it. But yeah, so when there's when there's issues with the liver and gallbladder, a lot of times that's gonna, of course, affect like detoxing and elimination. And then, when there's stuff going on in the gut, that's also gonna affect detox and elimination. A lot of times what's going on in the gut is affecting the liver. And then that's gonna, of course, affect the thyroid. So it's kind of like one of those things where it's like, it's kind of a vicious cycle, and it's probably you're never gonna find like what's the chicken and what's the egg. Like it's probably gonna be they're kind of encouraging each other on. But I think like overall, just really working to support all the detox pathways that you can, and really, really work on estrogen elimination. And then once it's eliminated, so like working on bile flow, working on all the nutrients that you need to get the liver making bile, making sure, maybe checking those detox pathways with something like a Dutch test. Because the Dutch test helps you see like phase 1 and phase 2 of detoxification. Organic oats tests also are very helpful because they're seeing what you're eliminating, and you can often see a lot of signs of bacteria and fungus and other nutrients, maybe your glutathione production, stuff like that. So trying to get some insight as to like how that gut and liver is functioning, and then supporting it more. And then like systemic enzymes can always be helpful. If we're struggling with some mystery issues, a lot of times they can help kind of break down like fibrotic tissue, inflammation, stuff like that. Because oftentimes like the estrogen and iron does cause fibrosis. And fibrosis is kind of like that scar tissue, that scarring of certain areas in the body, and that can affect everything from the joints. Like some people get blocked fallopian tubes. Like it can be kind of like endless. So kind of remember that estrogen and iron love to kind of cause this like fibrosis. So that's where sometimes like systemic enzymes can become very helpful. Things like serrapeptase and nattokinase. Just make sure like if you're taking medication, you make sure there's no contraindications. But yeah, like it's not there's never like a perfect answer, but it's kind of like one of those things where if I was struggling with a liver condition, I would be really hyper focused on what's going on in my gut and what's going on in my liver. I have a allergic reaction to corn and mango. It consists on gallbladder attacks, very, very painful. And can this be healed? Thank you so much, Jess. That's interesting. That's very specific. I wonder if like those specific foods are feeding a certain bacteria that's bothering the gallbladder. That's just like one theory. It's just so weird that it's like those two foods that would cause a gallbladder attack, because usually gallbladder attacks are caused by like fats. So I'm not really sure, but that is really interesting. Were you able to get off thyroid medication? Yeah, I no longer take thyroid medication. I've kind of talked about one of my lives before. Like one day I was just like, why am I getting so hot around like 2 p.m.? Like my like cheeks were red, and I was just like, I am like so hot. Like what's going on? And then I just was like, maybe I should take a thyroid test. Like sometimes I'm just like, I'm so focused on everyone else. I'm like, oh, maybe I should take a thyroid test. And I took one, and I was like really pushing myself into like a hyperthyroid state. And I was like, oh, I don't really think I need thyroid meds anymore. So I went to the doctor, and she was like, no, like what happened? Hi, Jess. Near the end of my cycle, my tongue becomes raw and a bit painful. I have always assumed this is due to an iron deficiency. Do you have any thoughts? Magnesium deficiencies often cause like a sore, swollen tongue that has like teeth marks on the side. It can also be like a sign of B vitamin deficiencies or like a need for B vitamins. And because we're being depleted, remember we're bleeding, so we're losing like all minerals and lots of nutrients as well. Remember, like it takes work to contract that uterus, and it just takes work to be on our periods. I know the small intestine is supposed to be sterile. Will you explain probiotic foods then? Like, how do the good bacteria get to the colon? I know people get a lot of good from properly fermented foods. Do they, though? That is the question. I think like sometimes fermented foods actually cause more problems than they solve. This is why a lot of people end up developing histamine issues, because they were like, oh my gosh, I did all the probiotic foods and like all the kombucha, and then now they have like serious SIBO and histamine issues. So like I'm not super convinced that like eating a ton of fermented foods is a good idea. A bite or two of sauerkraut is not going to hurt anybody, but I just am not convinced that like pounding fermented foods is a good idea. But yeah, your small intestine has things in place to keep it sterile. It's not like it just like sits there and just like is like whatever comes in like can stay here. A healthy functioning body has bile, which keeps the small intestine sterile if your gallbladder is functioning properly. But again, that requires good thyroid function. There's also enzymes that both the pancreas and the small intestine make that again require good thyroid function. There's also stomach acid, helpful, but requires good thyroid function, and low stress. And then you have a migrating motor complex, which is kind of like, you picture it as like kind of like squeezing a tube of toothpaste. It's how the body kind of keeps the small intestine sterile. But the migrating motor complex needs, you guessed it, good thyroid function. So a lot of people don't realize that SIBO is stress-induced bacterial overgrowth, because if you have stress and poor metabolic function, all these systems break down and you no longer have anything protecting your small intestine from an overgrowth of bacteria and fungus. What could create moodiness or aggression when switching from raw vegan to a pro-metabolic diet? I just feel stressed adding in animal foods. I would just maybe like evaluate my mindset regarding them. Like, do you still have some mental blocks that they're bad for you? And then also like going from raw vegan to pro-metabolic is quite a difference. So there's probably like gut issues. There's a lot of different, like, because when you're eating a high fiber, like high nut and seed, I don't know what type of raw vegan you are. Like, I don't have enough context, but this is all like me just making assumptions at this point. I'm picturing like a raw vegan diet that contains a lot of like, raw nuts, raw seeds, lots of raw vegetables, possibly fruits, things like that. Oftentimes, this is a very gut irritating diet. It feeds a lot of bacteria, different bacteria, than when you're eating animal foods. And when you're vegan, remember, like, if you don't use it, you lose it. And so most vegans have horrible stomach acid production. Enzyme production is very, very low. And so when they start to eat foods that require these things to be digested, they often run into lots and lots of digestive issues, which can come out in the form of any type of, symptoms, but moodiness can be one of them. So stomach acid is one of those things that is important, and it can take some time to get back. This is why like bone broth and gelatin, like gummies and things like that, are so helpful, because like going from eating like a diet that doesn't require your digestion to work very hard to now something that like requires your digestion to work very hard can be like a huge jump. But there's this girl that Matt Blackburn did a podcast with on Mito Life Radio. She like is an ex-vegan, and she talks about gut issues, and I'm like spacing on her name, but you can probably scroll back in those interviews and find that episode. Would a spore-based probiotic be a good replacement for carrot salad while traveling? There's no replacement for like a raw carrot salad, but I think like the closest would be, for me, like if I want something that's really portable, I do activated charcoal, or I just bring carrots with me. They last pretty well. Like I've brought carrots on a plane with me, and I'll like eat them while I'm on the plane, or like a big bag, like I cut them into sticks, and then I just kind of snack on them for like at least my travel day. And then usually when I get to my destination, I will inconvenience someone to take me to get carrots. But if not, I always have activated charcoal with me and Cascara sagrada, just to like, especially if you get like traveler's constipation, it's always a good idea to like bring something that's going to help keep things moving. Sorry, I was mostly fruitarian. Oh, then yeah, I mean, that's like a very different type diet because it's just like very, um, it's yeah, it's not as bad as like something that's very gut irritating, but it's still like it's not requiring any type of digestive capacity in regards to like stomach acid. Protein is like the building blocks of the whole digestive system. And so when you aren't eating protein, you don't make a lot of these digestive juices, like gastric juices, like stomach acid, enzymes, things like that. So it can be really like, think about it. You're like throwing like a piece of meat. So your stomach's supposed to be like battery acid, right? Like battery acid, if you got it on your hand, it would like burn a hole in your hand. If you got stomach acid on your hand, it would burn a hole in your hand. So think of like throwing a meat into like a cup of battery acid. It's going to be like zzz and like break up. And then like think about throwing like a piece of meat in like apple cider vinegar. It's just going to like sit there and kind of like rot and kind of get like kind of soggy and gross. That's what you can kind of picture in your head. Like it's just going to take time to build stomach acid back up because you need protein to make stomach acid, but then you also need stomach acid to break down protein. So this is where like bone broth and gelatin can come in handy and really, really help us build back our digestive capacity. And I've seen vegans have to take like a good 6 to 12 months to restore their digestion. Like it's not usually an overnight thing. Okay, I know some claim to reduce endotoxins. Yeah, spore-based probiotics definitely reduce endotoxins, and I definitely see that. I'm more talking, I guess I'm trying to talk about like the fiber aspect of the carrot. Like they're not going to take the place of the fiber aspect. And if doesn't matter if you're taking a probiotic to reduce endotoxins, if you just have like a bunch of food just kind of sitting there and you're not regular, then it's still not going to help. I was vegan and it ruined my gut. Now I'm here. Will your program work for people with endometriosis? Endometriosis is kind of complicated because there is a bacterial component a lot of times. But yeah, there's a lot of like an estrogen component. So there's a few women who have with endometriosis who have taken Fully Nourished, but oftentimes they have to go very, very slow and implement things very slowly because they're so sensitive and like their periods are usually already so bad. But yeah, I mean, estrogen dominance, like gut bacteria, limiting toxins, like all those things are very important for endo as well. In FN, you talk about how 2 steps forward, 1 step back. Have you yourself experienced this at all or just the beginning of your healing? How did you handle it mentally? I just like am aware that my body is for me and not against me. So our body's goal is homeostasis, right? But it's only going to balance itself out if it has the materials. So I think for me, I think a lot of people have this very victim mentality, like my body's doing this and like, oh my God, like why is this happening to me still? Like I've been working so hard. Like I hear it all the time. And it's one of those things where we have to take a step back and realize like, let's just acknowledge our part in it. We don't need to blame ourselves. There's no need to feel like guilt or shame or blame. It's just more like, yeah, I've probably done a lot of crap to myself the past 10 years that has led me to this place. And so like, why would I expect my body, who has not had what it needed for so long and has been doing the best it can for so long, to just immediately be given what it needs and be like, oh, I'm better. It's just kind of like unrealistic, and it totally just shows like our need and our desire for like this instant gratification in our society and our culture. So that's kind of like my mindset towards it is, yes, I have experienced that a lot. I did a lot of really crappy things to my body. Like I really thought I was in incredible health. I looked it. I was very lean. I was ripped, honestly. I was super productive. Like I would wake up at 5 a.m. and like go to the gym and like, come home and like start working. And I worked like a marketing job, and I, was starting my business on the side, and I was going to school, and I just thought I like had my, what together. And I was all the while eating this like very low carb kind of restrictive diet. Now this was like at the direction of like my naturopaths and my nutritionists. Like I was taking all these supplements, and I look back now and realize how much I was running on stress. And the reason that I stopped doing what I was doing was not necessarily because I was feeling bad, like so awful, like I'd hit a wall. Really hadn't gotten to that point yet, but I was very disordered in my eating habits. I was consumed with food. It's literally the only thing I thought about. And I also was like experiencing hair loss and anxiety, and I was very snippety and irritable. I also was in a very like masculine mindset. And I know some people might not understand this, but like I was very much like just like goal oriented, hustle, 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 like didn't care. Like I just could not get into that like feminine, like rested, like I don't know, like softer place. Like I was just a very hard, like harsh person. And because I have a tendency to be that way already. Like I just have a tendency to slip into like a very type A hustle, hustle, hustle success mode. And, you know, it was like the small signs that were getting to me. And then as I started to read more and more and research, and I like became aware of Ray Peat and listened to Danny Roddy's stuff, like I really started to dig into the research. It was like so eye-opening to me. And so I started to implement this stuff, and I felt like absolute shit. Like I felt horrible. And I had horrible gut issues, like horrible. It took me probably a year before I felt like my gut wasn't in knots. I totally burned out my adrenals. Like implementing sugar made me feel so anxious, but at the same time took away my sugar cravings, which I knew, okay, my body needed this, but I'm not handling it well. Like, oh yeah, if if I was a poster child for how crappy pro-metabolic eating feels at first, I would be like the poster child. Like I literally had the worst symptoms. My gut was a wreck, like my skin was a wreck. I like wasn't sleeping well, like I didn't feel that great, but I was able to like have hindsight and realize like how stressed out I was before. That was the one thing that I really was made aware of, which made me keep going, is I just realized like before I was running myself ragged into the ground, but because I didn't feel like that was happening, I didn't recognize it for what it was. And so now, and even like as I've recovered, I'm still more, now I've swung to the other direction where I'm just like relaxed all the time, kind of chill. Like it's really weird how this happened. And I'm like probably, I guess like 3 years in now. And I'm just really starting to like be like, oh wow, I'm like feeling good for the first time in a long time. I don't think I've ever felt normal, like since I was like 10 years old. So I think that's important. Like I've probably been through 16 years of just ups and downs. Like I had horrible hormonal issues even before I went through puberty. And then like I went through puberty and immediately like all my issues were there right when I went through puberty. So I've had like a lot of ups and downs, and nothing's perfect. Like I don't think my health is perfect. I still am working on some gut issues. I'm still working on adrenal issues because like I also have a very stressful like job. I run a company. So, of course, it's kind of like 2 steps forward, 1 step back. If I could like just focus and devote every hour of my time to healing, I probably would heal very quickly, but I can't. And so, it's kind of like you got to live your life while you heal. And you also have to like keep uncovering things. Like healing is always layers. There's always layers. So I just want to like encourage you guys and say like, yes, I've gone through that before. It's not easy. It's kind of difficult, but in hindsight, I know what I was doing before wasn't working for me. Now, of course, I've had those thoughts where I was like, it'd probably just be easier to go back to like a very restricted diet because I didn't have these symptoms before. But then I'm reminded like, oh, but my hair was falling out and like my libido was shot. There's other things. So you kind of have to like talk yourself down off the ledge. Yes, 2 steps ahead, 10 steps back is more like it, LOL. But I've taken what feels like 1,000 steps forward the last 2 years since finding your work. So thank you. Of course, and I'm not perfect, you guys. Like I'm kind of on this journey too. I think it's like important to just recognize that. I think a lot of people who, especially practitioners, try to like put themselves as like this, like they're like, they have it all figured out. And it's like, I'm just ahead of you in the journey. And I also like have a lot of experience with working with people. I I have a knack for this work. Like, it's just like, I get it really quickly. I like love it. And so that's why like I retain all this information, but in no way, shape or form is like my health perfect. And I think like a lot of practitioners will like try to like sell that to you, that their life is perfect and they have it all figured out. Or like they'll do like this kind of staged vulnerability, but we're all just trying to like figure it out. And I know that I'm in the right direction though. Like, I'll never change my mind. Like, I changed my mind about keto and all that stuff. Now, within the pro-metabolic space, there's about a million different opinions on things like fiber and fats and supplements and, you know, so many things. And that's where like we have to really experiment and figure out what works for us. But at the end of the day, it's one of those things where it does take time. I appreciate you mentioning femininity. I'm only now realizing the importance in reconnecting to this. I feel like I was raised to bury this and embrace the masculine mindset, as you say. Yeah, I did that until I was like 23. And I was like, I'm going to be a corporate lawyer and I'm going to do this and I'm going to do this. And like, I was just so like willing to just run myself into the ground. And I also like, that affected me emotionally as well. Like, I had to harden myself almost to the point where like nothing would affect me because I was pushing my body so hard. It's like if I took a minute to slow down and feel the pain, like not only would I gorge on food, but I would just like bawl my eyes out because I was exhausted all the time. You know, it's like we are not men and we are not meant to be men. And so like, and that doesn't mean we're weak. It just means we're different, which is awesome. Like, we have this amazing body that like can't compare. And so it just requires a lot more, like a lot different perspective. And that's the problem with a lot of the health and wellness industry is like a lot of these studies and a lot of these like, a lot of this research is being completely based on men, and they're not taking into account that like we're completely different on a biological level. Like, our biological purpose is not like hustling, providing, being a warrior. Like, we are the nurturers, we are the hunter-gatherers, we are the protectors, we are the literally like we birth society. And that's like, you know, without us, like man would cease to exist. And so like, that's not weak, that's strength. So I just see it differently. I know like some people think that acknowledging like femininity is weak, but I actually think it's a strength. Thank you so much. I really appreciate the time you take to answer our questions and help us out. God bless you always. Thank you guys. Like, this was, you guys know I love our lives. So I'll see you guys next Wednesday on our regular Wednesday live. And another question. So my concern is I'm eating too many carbs and that's why I have higher blood sugars. How do you know if it's because you're not getting enough carbs or getting too much with high blood sugars? It just depends. Like, if our high blood sugars are after we've fasted for 10 hours, it's not, it's not what we ate. If we have high blood sugar immediately after a meal, like about an hour, then we're not clearing sugar well. But yeah, I mean, sometimes it's not even like if we're eating too much or too little, it's actually like what we're pairing it with. So, you know, I'm a big fan of pairing it with the right types of fats, those saturated fats, staying away from PUFAs. And then also like protein is so important for women and they can't forget it. So protein is what helps balance out those carbohydrates. Like protein will, you know, protein oftentimes lowers blood sugar, whereas carbs will raise blood sugar. And so you know, when you have protein, it's keeping blood sugar balanced as carbs are trying to raise it. But yeah, you know, we have to kind of experiment. And if you're so concerned about blood sugar, then we need to watch our blood sugar numbers. But all the while looking at the context of other things like sleep, temperatures, pulses, mood, if we're ovulating or not, how is our period, how is our PMS? Like, there are so many other factors to health, not just blood sugar. So it's just important to remember that. But if you haven't already like downloaded my free temps and pulse training, that's maybe a good place to start if you want to learn more about that. But yeah, I mean, it's not usually about too much or too little carbs. It's usually like, what is your meal looking like overall? So are we balancing each meal and snack with enough protein, carbs, and fat? And then are we eating consistently and regularly every 3 to 4 hours? not sporadically eating at weird times all throughout the day. Every day is different. Like, of course our body is going crazy. So just like reminding ourselves of that, like sometimes we get really caught up on the numbers and we actually forget everything else. Jess, I'm tuning in late. Did you talk about skincare ingredients with gums in them and should we avoid them? Yeah, I did. I answered that at the beginning. Pretty much I just said that if, you know, it's minimal in ingredients, it's probably not gonna like be a problem if we're looking at it from like a gut irritating perspective. But I also did say like those are kind of some cheap fillers and emulsifiers. So I would evaluate if like why companies are using those things. Like they could be using a lot healthier emulsifiers and a lot better and more expensive ingredients, but they're not. And so that kind of like would make me question the just the product overall. But overall, I wouldn't stress about like putting something like that on my skin. All right, you guys, I love you so much. And I'll see you guys next Wednesday. Bring your questions. And until then, I'll see you on Insta. YouTube channel. So I do want to review, since you guys are here. You guys are like my core group. And I know there's a lot of people that come and watch these later, but I just wanted to remind you guys like what's coming. So the YouTube channel should be out the beginning of February, like probably that first week. Then Nourished Gut, my gut program, will be out in April. Mid-April towards the beginning of May. And then there will be other offerings as well, like towards the end of the year. So just so you guys kind of know what's on the sketch. But I'll see you guys next week. Love you.